Yeah, perfect. So we're Team 7, and we are presenting DoSecure. 40 Americans die each day from opioid overdose. Medication delivery for opioid addicts recovery is severely flawed. Pills don't always work because they ignore what a huge role human compliance has in recovery. Given this, our solution is to create a medical device known as DoSecure that will transdermally administer opioids in a secure manner outside of the traditional healthcare setting. We see vast potential in this $1.3 billion market. Our primary use case will be with motivated recovery prospects. So let's quickly go through our new care delivery model. A chronic pain patient presents to the doctor. The doctor prescribes the DoSecure Band app versus the traditional pills to reduce patient error and increase patient compliance. The patient picks up the band from the pharmacy, downloads the app, and is given detailed user instructions by the pharmacy tech. Over the course of the care plan, the patient visits the doctor and pharmacy weekly for evaluation and tapered refills. Real-time data is uploaded to the cloud throughout the care program, ensuring smarter, more targeted clinical decision-making. So now let's dive deeper into this DoSecure Band.
So this is basically our device. This is DoSecure. Yes. This is DoSecure. Basically what it does is that this is a physical device that will deliver from a cartridge, which I am holding on my hand. It will deliver a specific metered, safe dose to you at exactly the right time in exactly the right dose. Now, this cartridge has self-tampering deterrent technology. What it will do is that it will actually neutralize it if the person tries to neutralize the cartridge. Because we have 4 different cartridges on this particular device, you will be able to actually receive your opioid and also other painkillers that are not necessarily opioids, but will enable you to actually experience a decrease in pain. Something else that we can also do with this is that we can expand functionality to have data retrieval for market purposes or data mining purposes. This can be worn in your leg, in your arm. It's very discreet. It's partially reusable, and it communicates to our app via Bluetooth, and it's also refilled by your pharmacist over the air. Again, it's a very safe, secure, tamper-proof method of having your dose delivered, and it eliminates human error out of the equation.
We also have an app that is integrated with the device and with the Health Cloud. Our app is interoperable with multiple platforms. It's able to talk to Salesforce. It has a decision-making tree that can recommend alternative pain control, where a patient has the option of choosing that alternative pain control or not, including mindfulness behavior. All that data goes back to the cloud, where the provider, we also have a provider interface where they can log in and monitor compliance, monitor response to intervention, overall, this will improve healthcare outcomes. And our progress in this app is actually more than a prototype, and we actually do have a markup of the app that we can show. In terms of commercialization, wearables is a $6 billion market, and the opiate management opiate drug is a $1.3 billion market. Given that we're interfaced between the wearables and drug delivery, this is a huge and novel market that we can target. Between year 1 and 3, we're planning to go into product development and get advice from experts like yourself to help us get through clinical trials and more investors.
Thank you.
I like the concept. I like the pain management doctors talk about it, but I see the challenge in drug delivery. It's not an easy job. It's very much regulatory prone, and it requires the medications to be exactly in that nature and transcutaneous and drugs. So you're taking 2 big challenges, one really huge challenge and kind of putting into it. So I wanted to see what other people say, if that's feasible at all in terms of feasibility later on.
Well, there already is a device that actually delivers pain medication through a button that you press transdermally. that controls the dose that you can get. The patient can keep pressing it, but it doesn't have any of the integration as far as going into a cloud and letting the physician see how often they're pressing it.
Keep in mind, this is also multiple drug delivery, not just
Yeah.
one.
The
So
one
that's
question
very
that I
unique.
had for you that I could see a huge potential market for is actually weaning patients off.
That's, so that's actually the initial goal of this drug delivery, is to slowly taper the dosage of opiate use and providing additional alternative methods, including mindfulness and other anesthesia.
Is there a way to monitor blood pressure, pulse,
Yes,
sweat?
we actually have that. We actually have that planned for the version by you monitoring your data, and again, that is given back to the cloud. That way, you as a doctor can measure what's going on after the patient receives the dose, or if he doesn't, or if he's requesting a specific dose.
I have two questions. What's your competition? Is there you have a lot of competition? You're the only one designing this.
I think, so we're the only one designing this. What we've done is we've taken functionality from various different products that are out there and combined it.
Okay, one question while I got the table. I'm doing research. I've got to get all kind of IRB issues. This is no problem with that close monitoring the patient. There's no issue with ethics of monitoring the patient.
Oh, okay.
Thank you.